Welcome back to the Health Channel. All health, all the time. I'm Kathy Buccio. Remember, if you have any questions for the experts, give us a call on our toll-free number. Alicia's waiting, 855-796-4475. We'd love to hear from you. Alicia Soler Cancio, a physician assistant at Miami Cancer Institute, an advanced practice provider for the Survivorship program, is joining us. And also joining us is Ginelle Ruffa, health and fitness coach, as well as Miss Miami Beach 2017 and Miss Fort Lauderdale 2018. Welcome, Ginelle. Thank you for being here.
Thank you so much for having me.
It's great to have you on the show. You have such an inspirational story to share, and I've loved your journey. And you're a fitness coach for cancer patients, is that correct? And we mentioned in our last segment that your older brother has beat cancer twice with a 1% chance of survival. Please tell me how you got into this and how you got into sports medicine.
Yes, my brother is truly an inspiration to myself and my family and so many people throughout the world. He is a walking miracle. He was diagnosed with stage 3 rhabdomyosarcoma at the age of 2 that was originated in his sinuses. He had gone into remission for a year and then relapsed as a stage 4 lung cancer as a 4-year-old. And so, you know, his prognosis was a less than 1% chance of survival, and just all that he had to endure between his surgeries and bone marrow transplant and everything. He truly is a walking inspiration to us all, and his story really just has inspired us all. My dad's a physician and my mom's a pharmacist, so he did undergo traditional cancer treatments, chemotherapy and radiation, but also my parents just wanted to maximize his health and his long-term survival, and so they incorporated a lot of natural remedies as well. My mom would even juice him through the feeding tube and do supplementation. She was just researching day and night all that she could to maximize his long-term health. And so that really, I was born during that time. He's 2.5 years older than me, so I was born during his battle. I was actually born in the Ronald McDonald House in Pittsburgh while he was in the hospital.
Oh, goodness.
Yeah, so
and he was there since he was 2 years old.
Yes.
Wow.
Yes.
Wow.
So my birth kind of signified a promise of hope and healing for my family, and that's kind of my promise to signify hope and healing for other patients who are enduring this as well.
Absolutely. And let's talk a little bit about how long have you been doing pageants? How is that empowering you to continue this journey into a healthy way or a holistic way, I should say, of helping cancer patients?
Yes, I started with the Miss America organization last year. I started a little late because I'm actually at the end of the age limit now, but it really had inspired me. I had always, you know, watched Miss America and admired it as a child, but I really didn't understand the depth of the organization, what it truly stood for. And when I did my research, I realized that it really was a community service organization committed to just serving our community using a platform that you're passionate about, which mine obviously for my entire life I had been so passionate about educating people on proactive steps toward prevention, and so that naturally became my platform. And I'm so grateful for the wonderful opportunities the Miss America organization through the pageants has given me to just speak on that platform and just visit children in the hospitals and schools and just continue to speak and educate on cancer prevention.
And you started this program, it's a cancer-related fatigue program.
Yes.
Talk to me about that and what that does.
Yes, I recently graduated from Palm Beach Atlantic University with an exercise science degree, and the university offers a very unique and innovative exercise oncology program called the Cancer-Related Fatigue Program. I know you were speaking earlier about the side effects of chemotherapy and radiation are just extreme fatigue. These patients barely can get out of bed in the morning. The last thing they would want to do is go to the gym and exercise. But the effects of exercise on the body are absolutely incredible to a cellular level, oxygenating the cells, balancing the hormones, strengthening the immune system. So we've, as an exercise trainer, I get to see those incredible transformations throughout the course of, you know, 6 to 8 weeks. These patients are on these personalized exercise plans, and they just go from that weak state of fatigue to this strong, energized state. A lot of them, you know, running on the treadmills, lifting weights, and it not only strengthens their physical bodies, but their mental health as well.
And you actually help patients who have undergone chemo and even during chemo or other forms of treatment for cancers. Is true?
Yes. So with the exercise cancer program, these patients are anywhere from stage 1 to stage 4 cancer that are undergoing their chemo and radiation, and various types of cancer, breast cancer, lung cancer, prostate cancer. All types of patients are part of this program, young patients, older patients, and it's really just amazing to see how exercise and nutrition as well can help them in their recovery and treatments.
And Alicia, this is something that you actually had mentioned before, which is the importance of keeping active after
Correct.
chemo and after your treatment. And Ginelle, this is something as well that you do with your clients, is you put them on an individualized plan, correct?
Yes.
After their treatment. Tell me how that works.
Yeah, so our supervisor for the program is a physical therapist, and it's really important to individualize the fitness plans for every person, just as you would as a personal trainer, based on their physical strengths and weaknesses, but also based on the type of cancer they have. So for instance, breast cancer patients, we want to be very careful of the upper body exercises that we're doing with them, and depending on their stage of treatment as well. So it's very done under the supervision of doctors and done in a very medically sound way. And so these patients are on an individualized plan for the semester, and then they are empowered to continue that, whether it's in the program or on their own. Even in the summer months while we're off, I see all of patients coming in doing the programs that they have learned. We teach them the technique of the exercises. Yeah, and so they stick with it because, I mean, they are completely transformed by it.
Now, Alicia, diet and exercise, how important are both simultaneously after you finish treatment?
Very important, because there are foods that have been proven that can help so that your cancer doesn't recur. They provide antioxidants for the body, and we know that antioxidants are good to help eradicate cancer. So
specifically, which foods are you referring to?
So like we're talking about green foods, so like broccolis, green plant foods, and also all of the berries that are dark. So let's say blueberries, raspberries, strawberries, all of those have a lot of antioxidants, and they help so that the cancer doesn't recur. It's not that they are a cure-all, and it's just that many things in conjunction
help.
And yes, like Ginelle said, it's important for you to do exercise, because the exercise in itself does keep you physically fit, so that your stamina is important. And you can also then tell if you start feeling different. You say, wait a minute, I was feeling this way, now I'm starting to change. Could something else be going on? Could this cancer be recurring? So you have a little bit more of control of your own body.
Right.
And also because it does help so that you feel your best and you're able to fight whatever comes your way.
Absolutely. And Ginelle, you mentioned earlier that your mom used to different juice combinations in your brother's tube while feeding, anything that would help him. So talk about a little bit of that, those juices and how they help the body during cancer treatment and even after.
Yes, absolutely. As she was explaining, I always say to eat the rainbow, eat and drink the rainbow.
Eat and drink the rainbow, I like that.
Because each, and not Skittles, but
not Skittles.
fruits and vegetables, but each color of fruits and vegetables and produce contain unique phytonutrients, as you were describing, that can help strengthen the immune system and fight free radicals and help combat, help the body to naturally combat cancer. And so, like you were saying, the dark leafy greens vegetables are great, high in antioxidants, high in detoxifying nutrients. The dark purples, again, strong antioxidants. The red contains lycopene for heart health. Every fruit and vegetable contains
so eat those things.
Yes. Yes. Eat and drink.
Drink and eat those beets.
So the great thing about juicing, my mom literally raised us on juice twice a day. She raised us so healthy because she wanted to maximize our prevention as well. So juicing is great because you can get a whole array of nutrients in one glass. And she always would, she knew that if she sent us off to school with a glass of juice, at least she had filled our body with nutrients so that we were kind of set for the day. But juicing is so important. It takes away the digestive process. So even patients with certain stomach cancers that have trouble with digestion, the nutrients go straight absorbed into the bloodstream. It's just important not to include too many sugary fruits in the juice. You want to keep it dark leafy greens and more vegetables.
Something for flavor, but not incorporate too many fruits, because unfortunately they do affect our blood sugars, and that's not good.
Yeah, natural sugars, but still sugar.
Correct.
Now, Alicia, as we discuss diet, it's also important to note it's anti-inflammatory diet. That's key, especially for cancer patients. So how important is that, and what is considered an anti-inflammatory diet?
So an anti-inflammatory diet is really just where you incorporate foods that help with inflammation. Like Ginelle was saying, all those dark green leafy vegetables, they really help with inflammation. as well as those dark berries. They really make a difference. And there's certain things that you shouldn't eat. A lot of acidic foods, unfortunately, can cause inflammation of the body, as well as you have to be careful with people that have inflammatory problems like celiac disease and other conditions like Crohn's that do cause a lot of inflammation, a lot of autoimmune. So you try to eat those foods in conjunction with sometimes there has been studies that show that curcumin you can take as a supplement, and that can help reduce an inflammation.
And I know, Ginelle, you work with so many patients coming in and out on their exercise program, on their nutrition program. Is there a specific, besides your brother's, who's such an inspirational story, but are there any other patient stories that you'd love to share with us, sort of give someone hope? I mean, there's viewers watching at home, which I'm sure are going through something like this or know someone.
You know, I've encountered so many cancer patients through my family, through friends, throughout my life. I mean, I think that everybody knows somebody and loves somebody that is battling that. But there is hope. And one of my favorite connections that I built through the cancer fatigue program was a dear friend of mine. She actually endured breast cancer at a young age, like early 20s.
Oh my goodness.
Yeah, and she had undergone that battle for a couple of years, and now she's about my age. I'm 25. And she just recently got engaged, and I just went to her engagement party. She's a dear friend of mine, but she is doing so much better now through her treatments, through her exercise program and nutrition, and through all of these things. She is just doing beautifully now and ready to get married soon and start a new life. And so there is always hope.
Oh, that's a happy ending. And Alicia, before we go to break, we associate cancer. It's such a bad word. We hear it and we automatically just go negative, but it doesn't have to be a death sentence.
No.
Tell us a little bit about why. What other message of hope do you have for those who are currently going through something like this?
So next year, there will be about 20 million cancer survivors. Wow. In the 70s and 80s, there was about 3 million. That's a big difference. Yes, a significant amount of people that are surviving cancer. And part of the reason why they're surviving is honestly the treatment programs that we have now for them, but also all the support systems that we have for cancer patients, including the nutrition, including cancer rehab, exercise programs that we didn't think about before. We never realized how important they were to work in conjunction with the treatment itself. So there's a lot of hope out there. And cancer, there's no question that cancer does kill many patients, you know, but it is not a death sentence. Many people can survive this, and they can help themselves.
And hopefully that number gets higher and higher every year. Ginelle, thank you so much for being on the show. Thank you for doing what you do. The work you do is so important, so don't go away, because when we come back, we're continuing our conversation on what care is like for cancer patients after going through treatment, specifically the Survivorship program at Miami Cancer Institute. Don't go away. And you're watching the Health Channel on South Florida, PBS. Don't forget to give us a call if you'd like to ask the doctor a question. The number is 855-796-4475. Or visit our website, allhealthtv.com, where you can submit questions for the experts and watch videos from previous episodes. We'll be right back.